Simone, please tell us how mental health affects women.
Mental health problems like depression or anxiety, the common mental disorders, can affect women in a range of ways. A lot of women might not even know that they're experiencing these health problems. They may feel that their life is so tough anyway that this is just an extension of the ordinary. But in fact, it should be considered as an illness because people can get better with the right treatment. The way these illnesses impact women can range from how they look after themselves, how they look after their families, how they look after their health, whether they will attend health facilities, whether they will take medications that they should be taking, whether they use substances. All of these issues are much more difficult for women when they're experiencing depression and anxiety. There's a lot of pressure just to continue functioning with day-to-day activity. But these day-to-day activities, whether it's work, whether it's looking after kids, whether it's being in the home, whether it's social relationships, are all that much harder for women. There's a tiredness, there's an exhaustion, it's very low mood, there's a feeling that things aren't worthwhile, there's a lack of enjoyment in things. Right. I think if the symptoms have been present for a good few weeks, that's an important thing. And if they are affecting functioning, that's another critical thing. So if one's relationships are impacted, if one's work is impacted, if one's living in the home and in community is impacted by the symptoms, the mood symptoms, the negative thoughts, the worries, if those impact how one functions, then one can say that one is suffering from one of these mental illnesses and one really deserves to get help for it.
But how can they be managed, these mental health problems?
Well, there are
in your homes especially.
Okay. I mean, there are a range of approaches for managing these health problems. I think it's important for people to realize that they're not alone. These are common. That they're not to blame for these problems, just like you're not to blame if you have a skin condition, if you've got eczema, and that you can get better. I think those things are important to know from the outset. And then for people, for mothers to try and make sure that they're not isolated during and after pregnancy, to look for the healthy relationships in their lives and look after the ones that could possibly be good resources, whether it's a neighbor, a friend, a mother, your partner, your sister, who in your life can be there for you, who is somebody who you may be able to speak to about your feelings, who's not going to judge you, who's just going to listen to your story and acknowledge your feelings. Maybe it's a priest, a sangoma, an imam. If one cannot find that in one's private life, in one's social life, then it's important to look for it elsewhere and to go into the health services and ask for that kind of support, because it should be provided and people do get better with that kind of support. If necessary, some people do very well on antidepressant medication, which can be safe to use both in pregnancy and with breastfeeding. And in fact, that works very effectively for many women and makes a big difference both for anxiety symptoms and for depression.